Hello, you're welcome to my channel. Welcome to the teacher channel, and welcome to this presentation, First Aid Questions and Answers series, Part A. Let's see the objectives. Number one, to help you evaluate your knowledge of first aid. Number two, to be used to prepare for the first aid training. So if you are planning to attend a first aid training, this can help you to be used to prepare for the final first aid exam. So use this to quickly revise before the first aid exam. What is first aid? Question number one. And the answer, first aid is a basic or emergency care given to an ill or injured person. So that is the standard first aid. First aid is a basic or emergency care given to an ill or injured person. What are the objectives of first aid? Does first aid have objectives? Of course, there are three of them, three objectives of first aid. Number one, to preserve life. Number two, to prevent injury or further injury. Number three, to promote recovery. Those are the three key objectives of first aid. When you perform first aid, you are doing so to preserve the life of the patient, to prevent that patient from further injury, and to promote the recovery of that patient. A person who receives first aid is called what? So what do you call the person who receives first aid care? So a person who receives first aid care can be described as patient, victim, or casualty. So those are the three terms you can use synonymously, interchangeably, to describe a person you are helping during emergency scene management. When you manage that emergency, the person you are helping is called patient, victim, or casualty. Many categories of patients are there. There are three categories of patient, and they are as follows. Infant, this is a person who is under 1 year old. Child, this is a person who is from 1 year until puberty. So more than 1 year but has not reached puberty, that is a child. Adult category is a person, contains persons who have reached puberty. So an adult is somebody who has reached puberty. Who is a first aid provider? Who is a first aid provider? This individual provides first aid or basic care to a patient. So first aid provider is an individual who provides basic care to a patient. The aim is to 1. Preserve the patient's life. 2. Prevent the patient from further injuries. Number 3. Promote the patient to recover. So the person who provides basic care to a patient is called first aid provider. Why is first aid training essential? Why is it necessary to attend first aid training? First aid training is crucial because it allows participants to learn the skills necessary to respond to emergencies. So first aid training is important, is crucial. Why is it important? Why is it crucial? It is because when you attend the training, you acquire the necessary skills you need to respond to emergencies. Remember, emergencies can happen anytime, any day. It can happen to anybody. It can happen to an infant, a child, an adult. And you need a set of skills that will help you respond to the emergencies when they occur. So, attending this training, attending first aid training will give you all those skills, will help you get information and knowledge that you need, and it is believed that the information you get, the skills you're going to acquire, will boost your confidence so that when there is an emergency, you should be able to respond appropriately. Is the first aid provider protected when caring for a patient? Is the first aid provider protected when caring for a patient? Very important question. And the answer is a resounding yes. The first aid provider is protected by the Good Samaritan laws. Good Samaritan laws protect first aid providers from liability, encouraging individuals to assist those in need. So Good Samaritan laws protect you, the first aider, from liability, and it is also an encouragement to individuals to help those in need. Why is it an encouragement? Of course, when you know that you are protected, when you know that you are protected by this law, it will serve as an encouragement so that you keep helping people in need. Please like, comment, share, and subscribe if you have not. Please, that will help the channel. Thank you so much. What must the first aid provider do to be protected by the Good Samaritan law? So this is important. We know that Good Samaritan laws protect you, and you there means the person who is providing basic care to a patient. So what must you do to enjoy the protection of the Good Samaritan laws? Let's see the answer. To be protected by the Good Samaritan laws, the first aid provider must fulfill the following obligations. So there are a number of obligations you must endeavor to fulfill if you want to be protected. And it is very, very important that you get that protection. But for that to happen, there are obligations to fulfill. Let's see them. Number one, you must use reasonable skills. Number two, you must stay within the scope of first aid. So don't go outside the scope. Don't do anything outside the scope of first aid. Number three, you must obtain consent or permission from the patient. Number four, you should never abandon your patient unless your life is in danger. You shouldn't abandon your patient. And number five, you must protect the privacy of your patient. So if your patient has volunteered some important information, some private information to you. Please protect that information. You can only share that information with other people who are helping you during that time. This is very important. Privacy of your patient is crucial and you must protect it. How many types of consents are there? There are two types of consent. There are two types of consents: voluntary consent and implied consent. Those are the two broad categories of consents. If it is not voluntary, then it should be implied. If it is not implied, then it should be what? Voluntary. Two types. What is the difference between the two types of consent? What is the difference between the two types of consent? Voluntary consent is obtained from a conscious patient who is legally and mentally able or capable, while implied consent is used by the first order when dealing with an unconscious patient or someone who has not reached the age to make decisions independently. The example is an unattended baby. So voluntary consent is obtained from a conscious patient. So if your patient is conscious, then you have to go for voluntary consent. Your patient should be able to give you voluntary consent. So it's voluntary consent. And that is the type of consent you obtain from a conscious patient. And this person is legally and mentally able and capable. Then the second one is implied consent, and this is the type of consent you use when you are dealing with an unconscious person or someone who has not reached the age to make decisions independently. And a good example is when a baby is left unattended. So you use implied consent if that baby needs help and there's nobody around, no mother, no father, no guardian around. You can use implied consent in that case. Otherwise, if the person is conscious, the person is an adult, the person is legally and mentally able and capable, you go for voluntary consent. What is channel or disease transmission? What is channel or disease transmission? This is the route through which disease-causing organism or germs move from one point to another point. So that is the channel, the chain of activities, the movement, the medium or media through which organisms, germs that cause diseases move from point to point. So it is called the channel of disease transmission. What are the routes of transmission of diseases? So there are four of them. There are four different routes of disease transmissions. Number one, direct contact. Number two, indirect contact. Number three, airborne transmission. And then number four is vector-borne transmission. So number one is direct contact. Number two is what? Indirect contact. Number three, airborne transmission. And number four, vector-borne transmission. What is vector-borne transmission of diseases? Vector-borne transmission is when people get disease from infected microbes. Example, when a person gets malaria from mosquitoes. So vector-borne is when somebody gets infected from animal bite or insect bite. A good example is malaria. Malaria from mosquitoes, that is vector-borne transmission. What is a hazard? A hazard is anything that can cause harm or kill a person. A hazard is anything that can what? Cause harm or kill. Anything that can cause harm, anything that can harm or lead to death. That is a hazard. A hazard is everywhere. Hazard is everywhere, at home, on the road, at a place of work. There are hazards everywhere. So that thing that can cause harm or death is called a hazard. Why is personal protection and safety crucial during first aid? An important question, why? Why should I take my personal protection seriously? Why should I take my safety seriously? Why? Personal protective and safety measures are essential during first aid for the following reasons. Number one, there is no completely hazard-free environment. Let us make it louder. There is no completely hazard-free environment. I hope you're not surprised to hear that. There is no environment that could be described as completely hazard-free. So that is one reason why you must be serious about protecting yourself and make sure that you take safety seriously. Number two, individuals may contract or transmit diseases during first aid. Yeah, that is possible. Why? Because everyone is potentially infectious. There is no single person that is not potentially infectious, not one. So you can contract disease, you can also transmit, because you, the first aider, is potentially infectious. Your patient is potentially infectious. So protect yourself and make sure that safety measures are in place. Thank you for watching. Thank you so much for watching. This series will be continued in part B. Part B, please watch out for part B. Watch out for part B. Come back to this channel and watch out for part B. Again, like if you have not done so, your comment is very, very valuable. It will help our channel. It will help this channel. Please put your comment down, share it to other people. If this is your first time of visiting the channel or you have not subscribed, please do that, and remember to turn on your notification bell. Thank you so much. I appreciate your time. Appreciate your time. You can always send us email at theteacherchannel@gmail.com. Thank you, and see you again in part B and other parts.